Hello, and thank you for joining us. I'm Jamitra Collins, Director of Professional Education at American Kidney Fund, and I'll be your moderator for today's session called Let's Talk to the Experts, a panel of healthcare experts. During the session, we'll delve into the role of three healthcare professionals who work in the kidney disease or rare disease space and hear about their daily tasks that impact patient care. Before I introduce our first presenter, I encourage everyone joining to please type your questions and comments into the chat box. We will have a few minutes after each presenter for Q&A, and we'll try our best to get to your question. Without further delay, let's begin. Our first presenter is Alicia Lawrence. Alicia is a licensed medical social worker and serves as the Information and Resource Services Manager in the Patient Services Department at the National Organization for Rare Disorders, also known as NORD. She is the lead provider of quality information and resource services to the rare disease community at NORD. She also provides education and support to patients and family members in their efforts to understand their diagnosis and available resources. Alicia has been in the field of social work for over 20 years and has held various positions in hospitals as well as community based agencies. She is passionate about advocacy as it relates to fragile populations in areas of physical and mental health, as well as social justice. Alicia, we're happy to have you with us today. I'll turn it over to you.
Thank you, Jamitra, and good morning, everyone. My name again is Alicia Lawrence, and I am the Information Services Manager at NORD. And in my role, I manage the Information and Resource Services team, which is just another way that we at NORD respond to the unique needs of the rare disease community. Next slide, please. Oh, never mind. Back one slide, please. So again, NORD's mission is to improve the health and well-being of people with rare diseases, as well as drive advances in care, research, and policy. Next slide, please. Just a little bit about NORD. NORD is a patient advocacy organization dedicated to all individuals with rare diseases and the organizations that serve them. We just recently celebrated last year our 40th year as the hub of the rare disease community, leading efforts to connect patients and patient organizations along with other holders, driving progress for all. In the late 1970s and 80s, patients and families with rare diseases felt alone and forgotten. At that time, there was very little to be done for the study of rare diseases or the development of treatments. So, leaders of several rare disease patient organizations formed an ad hoc coalition instrumental in passing the Orphan Drug Act, which created financial incentives for the development and treatment of rare diseases. Next slide, please. So, for many patients and families with rare diseases, NORD is usually the first organization contacted. And just some of the ways that NORD supports our rare disease community is through we have a policy and agency department, we have a research department, we have an education department. And last but not least, our patient services department, which includes information and resource services. Recognizing the needs of the rare disease community, NORD developed the Information and Resource Services team. So, within the patient services department is a fully operating phone bank connecting, directing patients and families to that communication center. And just a bit of a fun fact: in 2023, there was over 76,000 calls, and we answered over 73 emails. When people call in, it's usually about financial burdens, diagnostic or disease odyssey questions, household expenses, utility costs, travel arrangements or traveling assistance in and out of state to see specialists. And the really big one is copay assistance. These are really big barriers to care and access for patients and families across the country for the rare disease community. In 2023, NORD was able to provide over 6,000 financial support to over 6,000 patients, and over $33 million was totaled in helping patients. The assistance impacted patients residing in all 50 states and the three U.S. territories. We don't have, of course, programs for every diagnosis. So when patient and caregivers call and they're looking for assistance for a disease state for which we do not have a program, that's when my team, the Information and Resource Services team, provides information and other potential resources. Next slide, please. As stated earlier, for many patients and families with rare disease, NORD is the first organization usually contacted for support. My team is able to provide guidance and assistance to our community. Some of the inquiries that we do receive could be from newly diagnosed patients and families looking for information on their diagnosis. We do have a rare disease database. It's not comprehensive, but there's over 1,200 reports that are patient-friendly reading that patients can understand, along with organizations that support the diagnosis. We also get calls regarding finding a specialist. Although we're not medical providers, we're able to provide resources that may be able to assist. And we also have NORD Rare Disease Centers of Excellence throughout the country. Right now, where we have 40. They also call for financial assistance with copay medications and other medical needs. Navigating insurance systems. So there may be patients that call looking for how to do an appeal, how to, get a denial. There may be questions about if a medication is covered. So our team just sort of educates the patient or family or caller on what they can do. And then we also have our financial assistance. People call for financial assistance for procedures that are not covered by insurance. And we also get calls related to travel and lodging. As stated earlier, if they want to see a specialist, it may not be in their state. They're looking for resources to get to the appointment. Next slide, please. In my role as an information services manager, I do provide education and support to the patients and family members in an effort for them to understand their diagnosis, understand what treatments may be available, and other available resources. Although I'm not a medical provider, we do provide resources that may be able to provide some guidance. As previously mentioned, the patient services team answers over 76,000 calls and 73 emails last year, and most of those would include information and resource services calls and emails. Some of the inquiries, we do receive them in various ways. We do get phone calls, we get emails, we also get emails through our patient services communication center, but also through the submission through our website, and then also submission through the website via other departments. We address patients' individual needs, and I'd have developed a worksheet for the team to use to assist in exploring resources. We also use this information for data collection purposes to see what the unmet needs are in the rare community, as it may be a possibility to develop a new program. We also have an internal resource database where we vet resources and maintain them on a regular basis, as we do try not to provide resources that are not helpful to patients. Next slide, please. In my role as a social worker, it is important to build relationships with patients. Active listening is key in order to understand a patient's needs in this position. I hear from patients and families who always feel that they're not being heard. I encourage patients to advocate for themselves and how important it is and crucial. It's important to also offer them resources and support to help them fulfill their needs as they navigate their healthcare journey. Next slide, please. It's also important to consider a patient's feelings. We all experience emotions, and it's vital to recognize where someone is in their journey. I tell my team all the time not to take anything personal, as sometimes when patients can express anger, confusion, or anxiety. Understanding their feelings is key. Next slide, please. Let's also keep in mind that, I and other social workers and healthcare professionals, we're offering a unique form of customer service. So it's important to convey empathy, sincerity, and ensure our patients and families comprehend the information we are trying to provide. Next slide, please. Here's the contact information for our patient services and information services team. We do answer calls throughout the country, so we try to expand the time zone so that anyone can call us at any given time. Next slide, please. Here are some helpful resources that we use, and I hope it could be of any resource and assistance to others. And again, thank you for your time and your attention today.
Thank you so much, Alicia. NORD is such a special organization, so we're happy to have you be able to just introduce it to some of our audience members, or just provide, all of the updates that you did. So thank you so much. We have a couple of questions that came in. As you mentioned, social workers, they wear many hats. So you always provide assistance and resources to patients, but how can other healthcare providers support social workers in your role for patient care?
So I would say that, I think sometimes social workers are we're the consider and maybe I'm a little biased, considered to be like miracle workers. And I think it's important for um, you know, us to also advocate for ourselves, just like how we advocate for our patients and families. And, I think peer support is really important. And just raising awareness in the field of social work and what social work is all about. It is Social Work Month. And so it's actually a good time for us to be having this conversation. Thank you.
Absolutely, a great opportunity to highlight Social Worker Month and National Kidney Month. So that's wonderful. Another question that came in: how has your role as a social worker changed since the 2020 response to COVID-19?
So it's interesting because some of the things that I do. I work in the hospital also per diem, and realized that you know it was really a time when you really had to kind of take care of yourself and as well as patients. I was able to, and NORD oversee our COVID grant, and it was not only you just realize how much is taking in all of that information from other people, what it could potentially do to yourself. I mean, for me, it was, personally, it was hearing all of these stories, but at the same time, being able to um, assist all of these patients with various needs. The other thing I think what helped the field of social work too is that you realize how many resources are available. There was so many interesting resources that you didn't necessarily think about before. You had to kind of think out of the box. So if it is that someone needed money for medication, but there wasn't any necessarily any resources related to that, then I would say, okay, well, let's look at, your household expenses and see if we can free up money that way. So I think that it helped me to think more out of the box as it relates to resources for patients and families.
That's awesome. Well, thank you so much. Hopefully, we'll have time to answer a few more questions at the end of the session. So I appreciate your time, Alicia. Thanks.
Thank you.
All right. So now we're going to move on to our next presenter, Dr. Deborah Hain. Dr. Hain is a dual ANCC board certified adult and gerontological nurse practitioner who has practice experience within nephrology nursing, memory disorder clinic, and hospice care. Dr. Haynes' scholarly endeavors have focused on improving health outcomes for older adults with chronic kidney disease and those with cognitive impairment. Her current research interests are strategies to improve self management in an ethnically diverse population with CKD stage 4 and 5, and supportive care of older adults with CKD stages 4 through 5 and ESRD. Please send in your questions for Dr. Hain, and we'll try our best to answer as many as we can when she's done. And Dr. Hain, we're ready when you are.
Hi, thank you, everybody. I'm really excited to be part of this panel, and I do appreciate what was just said about social workers. I think we all work in a team, and we have to value each other and value the roles that each of us can provide to get the best outcomes for our patients. Next slide. So we have advanced practice providers in nephrology, and this is something that has really grown over the last decade. When I first became a nurse practitioner, there were very few of us in nephrology. And then when the reimbursement changed, it made a difference. And so we started seeing nurse practitioners and physician assistants in providing care for our population. So in 2021, we had over 300,000. I'm sure there's a lot more right now. Dr. Davis and Kim Zuber, Dr. Davis is a nurse practitioner and Kim is a PA, and they're working on another study. So I'm sure we'll have more than what we have right now. And it's really been a nice addition to the team. And their roles have gone across the healthcare spectrum for our patients. So we have CKD management, caring for those patients with kidney disease before they end up on dialysis, end-stage kidney disease where they're getting dialysis. We have people working in long-term care and in transplant centers. And so we're really able, with a team approach, be able to make that difference in the outcomes of our patients with kidney disease across the care spectrum. Next slide. So how does American Kidney Fund support nephrology nurse practitioners and PAs? I'm sorry that that's not on here, but there really has been a lot of educational materials that have been developed over the years for CKD and end-stage kidney disease to help support the care of our patients. They provide financial assistance for our patients as well. And that's something where we can work together with our social workers who have a wealth of knowledge of how to access these resources. We don't have to remember everything. We just have to work with our team. And they also have professional education that will enhance the care of our patients, as well as there are kidney disease. They provide care information across the care continuum. So regional conferences, there are CME opportunities, there is an ambassador newsletter. So I suggest that you really visit the site to see what they have to offer, because it's really can benefit your practice. Next slide. So what are the challenges we face? What I've heard is, when I first started in nephrology, I'd been a dialysis nurse for a long time, had worked in a CKD clinic for many years. So it wasn't as challenging for me. The biggest challenge when I started in 2002 was that there was few nurse practitioners, few PAs in practice in nephrology. So sometimes it was the challenge of people identifying the essential role we have. But if you're new to nephrology, I've had many of my students say, I'm going to start, in nephrology. What do you recommend? And I recommend that you connect to some of these resources, the American Kidney Fund, and we'll talk about some of them later as I go through the talk. The other problem, and so it's a lack of knowledge, a lack of experience in nephrology, and there have been many changes over the years to support our practice. The other part is delivering person-centered care in a value-based reimbursement environment. So we have quality indicators, outcomes that we have to meet, and we have aggregate data to be able to support these out. We have like KTOVV, other things in dialysis that we're looking at to say, yes, we achieve these outcomes, and they're attached to reimbursement. But then we go through we deliver person-centered care. For example, you have a patient who refuses, and I've had this, refuse to get a fistula. We try working with them, educating, try everything we can, and they still won't get a fistula. You have others who just no show for the treatment. So you're really trying really hard to support your patients and achieve, as well as trying to achieve these outcomes. So we're going from an individual to a population based. And so how do we care for them and provide the best care and really recognize that individualization? How to collaborate with other professionals. Each state is different, and state of Florida, we don't have full practice authority. I have a license in Utah, and Utah does. I can see the difference between autonomous practice in Florida and full practice in Utah. And so as nurse practitioners, we have variability across the states as to what we can practice, as well as for PAs, we see, and I'm not a PA, so I can't speak too much about that, but I just heard from someone that the restrictions of what they can practice, they have to practice under the auspice of a physician. In some states, and nurse practitioners have to do that as well. So that variability makes it challenging, as well as how do we connect with others? Where I find the hardest challenge has been in long-term care. We get a form saying this is what's going on with the patient. I mean, what we're supposed to send back to them, what's going on with the patient, but we don't always get feedback to what's happening with the patient, as well as trying to, if we don't have cis EHRs that really communicate with each other, there are challenges as well. So care coordination is always a huge problem. Poor care coordination leads to rehospitalization, unnecessary hospitalizations. So how do we communicate across the care continuum so that we assure that our patients are really getting the best care and that we're learning what's happening with our patients? I don't know how many times I've gotten a patient from the hospital and I have no clue what's going on with that patient. That leads to the next thing, effective communication. How do we communicate with each other? How can we communicate effectively across these different care continuums so we can provide the best care for our patients? And then we have some challenges. Our patients are using smartphones. They're good and bad. And sometimes the patient is relying on that smartphone and they're not paying attention to what we're telling them. It can be a very positive thing. In a little bit, I'll talk a little more about that and which ones might be good, how to figure out which ones might be the best ones for our patients. Next slide. So here is as we see, these are social media and support groups for our patients. There are many different support groups for our patients. And so I recommend that they get involved in these. And it really helps to be connected with others that are experiencing. You heard from the previous talk that it's important for them to feel that they're not alone. So the American Kidney Fund has their excuse me, they have support for patients, AAKP. There's also Lori Hartwell has a Hope Network for patients that's delivered in a positive way, the National Kidney Foundation. So really, and then there's dialysis patients, citizens education. There's a bunch of groups that our patients can connect to. And I recommend that they do. Some people aren't so good at social media. So having those support groups within our own community is good. And that's somewhere you can work with your team to develop an opportunity for our patients, particularly those that are going through the transition of starting dialysis and those that are going through the changes as they try to get a transplant. So having those different resources for our patients, and this is where the team is so important to connect with each other to find out what is the best for our patients to reach out to. We know that there's so much misinformation on the internet. So I always tell patients, I'm going to guide you to these sites and you can choose which one's the best one. I had a patient one time had been on dialysis well over 10 years, and he flew on a site. He only spoke Spanish and his primary language and very little English. And he flew on a site that said, oh, we can get your kidney function back if you just come back and we're going to put you on this machine and give you these pills. And so he said, should I do that? I said, no, it's never going to come back. They're not going to be able to do that. So we can find scammers who try. When we look at older adults in particular, they are at risk for extortion. It's the biggest form of abuse. So thinking of how we can help our patients to identify the best places for support for them and reputable places so that they're not getting scammed from somebody. Next slide. We know that mental health is very prevalent in our population with CKD and those on dialysis and stage kidney disease in transplant. The major one we've identified is depression. We know that social workers are very well trained in being able to address the needs of patients with mental health illness. However, they're so busy with everything. There's not always the time. So we all have to take responsibility to identify what if something change is occurring with our patients. So one of the questions I have is, well, how do we teach students about mental health and CKD? It's important to tell them about the prevalence, what we know, and medications that have been used to treat, as well as cognitive behavioral therapy, where to have resources, identify that we do have a social worker in our dialysis centers, our transplant. I really think we need the whole team effect in our CKD clinics. We need to have social workers, dietitians as well, and really telling them that this is prevalent and that patients go through transitions and they go through these periods where they can feel very sad. They don't want to know about dialysis. They don't want to know about anything. They just want to stay the way they are. And many times depression is a big part of that. So when we identify someone who's not running to move forward or hear about the options they have. I've had patients who came for CKD clinic who said to me, I'm only here because the doctor sent me. I don't want dialysis. I said, that's okay. You don't have to choose dialysis, but let's talk about it. Let's make an informed decision. What is the best option for you? What is most important to you? And what are your goals? Your goals may be, that person's goal may be that transplant. So how do we get to that transplant? But having students, people that you're training, other nurse practitioners, PAs that are coming new to to the nephrology community, making sure that they understand the importance of recognizing mental health and then providing the resources that are available for them. And I realize we have a limited resources for mental health providers, but we do have social workers who can help us with this as well. Next slide. So when we talk about kidney disease management, we really need more education for nurse practitioners and PAs, particularly those that are coming into nephrology as a new role for them. The National Kidney Foundation has a group where they have the nurse practitioners and the PAs together, and they have education provided there. So we can work together, find a mentor that can help, somebody that you can talk to. We always have our nephrologists who are wonderful to work with. They're very knowledgeable, but sometimes we don't. I've had students who say, I don't want to go to the doctor all the time. Do you mind if I contact you? I said, yes. And if you're fortunate to have another advanced practice provider, such as a nurse practitioner or PA in your group, go to them and talk to them, and also talk to the team. You can learn a lot from everybody on the team. What's important is I would learn a lot from our dialysis technicians. So I would come into a clinic. I come into a clinic, and the dialysis technician, I seen a little change in the fistula, and then you start to investigate. Their first line in providing care, and they get to know these patients very well. And then I would talk to them, I would talk to the patient, and then I would talk to the nurse in the excuse me, the charge nurse, and making sure that we're doing the right thing for that patient. We really could partner with other organizations such as American Nephrology Nurses Association, and there is an association for physician assistants. I suggest if you're a physician assistant that you connect with the National Kidney Foundation and speak with them, because they have a group of great physician assistants who really could support you in your journey. And then also partner with other groups. There are so many groups in nephrology now. You have American Society of Nephrology. There is the NephU, which is very helpful, and there's a lot of webinars. So just identifying what is best for you to learn the most you can and to connect with others. Next slide. What we want to do is prevent professional burnout. Professional burnout can occur for many reasons. It could be because you're having personal problems at home. You're feeling that you're overwhelmed. You come in the center. You have so many patients to see. You have to do education. You're overworked, working many hours. Maybe there's financial difficulties in your home, so you're working additional hours. In this population, our patients have kidney disease. We often want to tell them what we know is best. You do this because I know what's best. That can burn you out, because if they don't do it, then you start taking that burden on of what a person chooses to do. People have a right to do what they want, what they think is best for their self. We provide the education. I've written about a partnership model of care, and this is how I practice. I discuss, I interactively engage in dialogue with patients and families to decide what's best for that person. So I talk to them and I say, well, this is the options. This is why I would select this. This is why this. And then they tell me what they can and cannot do. I don't take ownership of anybody. I don't get angry if they choose not to do it. I let them know the information, what are the risks and benefits, and if they choose to do something, that is their choice. I don't write in my charts adherent or non-adherent. I talk about patient has made a choice, even despite being informed about X, Y, and Z. Sorry, my allergies are killing me in Utah. So it's really, really important that we don't take ownership. We don't own these people. They have a right to make their decisions. and sometimes they're depressed. And if we're on the journey with them and we treat the depression, they're more open to doing things for themselves that are in the best interest of their health. Next slide. So, what are signs of burnout? The big thing is we have chronic stress. So, you can feel it through physical headaches, GI, heart palpitations, frequent illnesses, feeling really tired, not being able to sleep. We could also have it through our emotional irritability, feeling helpless, sense of failure, decreased satisfaction in our job, decreased motivation. I don't want to go to that job. I don't want to go to that work anymore. Feeling detached, even having depression and anxiety. Next slide. How do we prevent it? First off, all the literature supports physical activity is the best thing for your brain, your heart, your health, your stress. So engage in it whatever you can do. It doesn't mean you have to go to the gym. Just go for a walk. Get out. What I do during the day when I'm feeling like overwhelmed, instead of I have people that say, "Well, I'm going to sit at my computer during my lunch hour." Get up and walk. I don't know if it's cold outside, just go out for a minute or go in another room. You need to have that mental break. I had a student in Guatemala said, "I'm just going to work through the lunch hour. I'm not going to take a break." I said, "Oh, no, you're going to." "Well, I don't want to eat." I said, "You don't have to eat. You need to get up and walk, even if it's for 15 minutes. You just need to step away. You need to, and physical activity is very good for you. Take a holistic practice. Take time to meditate. Take time to self-reflect. You heard earlier, take time for yourself. It's okay to take time for yourself. You are better off. I worked with people who have Alzheimer's disease and their caregivers. I tell the caregivers, you're better for that person if you get a break for yourself. Take whatever is important to you and take that time for yourself. Sometimes it's just not a great practice environment. Sometimes you just need to change that practice environment. Excuse me. As hard as that can be, because you may like certain aspects of it, sometimes you need to change to another job. Sometimes what you need to do is just talk to others that are in charge and say, "You know what? We need to look at this and we need to think about how we can improve this practice and work together as a team." Next slide. So this is where I did have here, what can you do? How do you recognize it? When you do what do you do when you do recognize it? Evaluate your options, self-reflection. Take the time to reflect on what's going on, what's happening in your life. Is your personal life crossing into your professional life? Can you separate those two? Are you becoming too attached to a patient and you're very upset because they're not doing what you think is best for them? Are you taking ownership of their behavior? You cannot do that. Cannot do that. I learned that early on, and you got to stop yourself. Not that it's hard not to build relationships with people you see regularly, but you have to take that time to say, where is my role, and draw those boundaries. Keep those boundaries. What are the boundaries between work and home, so you're not crossing over? If you're having depression or feeling anxiety or feeling sad and overwhelmed, seek some support. Find someone to talk to, your pastor, your church. Talk to a counselor, psychologist, a social worker, somebody who can talk to you about what you're feeling and try to help you develop strategies, coping mechanisms to support your health. As I said, physical activity, every talk I do, I talk about physical activity, mindfulness, being in the moment. Taking a moment to just close your eyes, take some deep breaths, put your mind, picture in your where your happy place is, where you feel the best. If it's the beach, if it's a mountain, if it's in your backyard, your garden, wherever you feel the best. Just take a few moments when you're feeling overwhelmed. When you have someone, that you're feeling like this person is really, you're starting to feel this emotion related to this encounter with a person. You step back and say, "You know what? I take a minute. I need a minute. I need a break." And I've done that where I say, "I just need to leave the room for a minute. I'm sorry, but please excuse me." And I regroup so I can come back and not be stressed. You got to have enough sleep. Sleep is so critical, making sure you get that sleep that you need. I tell one of my faculty I work with on grants and other projects, and she said, "Well, I'm going to bed. You continue to work." And I said, "Oh, no, no, no. My bedtime's now. I'm going to sleep. I'll get up in the morning. My mind will be much better, and I'll be able to work on it." Next slide. So the key takeaways here are we work together as a team. We are a kidney community, not just in your dialysis, in your CKD, your transplant center. we work together as a community across all care continuums, plus in these associations. There are places you can reach out to, connect with others. When I go to conferences, I connect with others. I love the networking. I'm learning, but I'm also connecting with others. Connect with other people who can understand what you're going through. Always take a person-centered approach to care, not a patient-centered. They're not always a patient when they leave the whatever care center they're receiving. I had a patient one time, a young man, say to me, when I'm done with dialysis, I go in the bathroom, I wash my face, I look in the mirror, and I say, do I look like a patient? No, I don't. And he walks out, and he's a person living with kidney disease. He's not a diabetic. He's not a kidney disease patient. He's not a dialysis patient. He's a person living with it. And our role is to help support them on this journey of living with this disease and the treatment that is involved if it's receiving dialysis. So how do we do that? We do not own a person, as I said before. So really getting support from others in the kidney community. Next slide. Here are some resources for you. And there are some, like American Critical Association of Critical Care Nurses has social media and information about burnout, the American Nephrology, American Society of Nephrology, American Nurses Association. If you're a nurse, if you're a PA, you want to make sure that you're becoming a member of your physician assistants associations. Being part of these associations is so beneficial to help you really reflect, have others who can talk to you and learn the best, how we can provide the best care for our patients. What is the best and latest evidence that supports that evidence-based practice? Next slide. I think that's it, right? Is that the last slide? Okay. Well, thank you so much. And sorry about my allergies are just killing me.
Okay. We're all suffering. So thank you so much, Deb. We appreciate all of that sage advice. You wear many hats, and we know that we can kind of take some of those gems that you shared, and hopefully the audience can apply those. We'll hold questions until the end, and we'll go on to Libby, and we'll have a few minutes to give you a couple of questions that came in. So sure. Thank you again.
No problem.
So our final speaker today is Libby Valenti. Libby is a licensed board-certified genetic counselor. She practiced as a clinical prenatal genetic counselor for over 21 years prior to joining Natera as a women's health medical science liaison in 2013. With Natera, Libby worked as a medical science liaison throughout the U.S. and in the Middle East. For the past 2 years, she has served as the Associate Director of Clinical Strategy and Development for the Organ Health Division at Natera. In this role, she heads Natera's patient matching initiative, linking individuals with rare kidney disease with clinical trial opportunities. Libby, thanks so much for joining us, and we're looking forward to your presentation, so you can take it from here.
Great. Thanks, Dimitra. I appreciate it. And thanks to Deb and Alicia for all the work that you do. I really do appreciate the time and effort that you take with patients. Next slide. And we'll go on to the next. So I'm a genetic counselor. I've been a genetic counselor for over 30 years. It's a field that sometimes people really don't have a great sense for what we do. So I came up with some familiar definitions. So genetic counselors are healthcare professionals trained in medical genetics and counseling. We help patients understand their genetic risks in the context of their own personal and family health history. We review risks, benefits, and limitations of genetic testing, and we help coordinate testing and interpret test results. So one of the big things that I've always thought of as far as genetic counselors is that we are truly patient advocates, and we are always on the patient side as far as what kind of information can we give them to help them understand their family history, and their risk of genetic disease. What kind of testing is there, and what are the advantages and disadvantages of that testing? Next slide. Sometimes websites will also mention, and this is sort of, in more recent years, since I've been a genetic counselors can also get involved in other different types of medicine. They can work in research, education, industry, marketing, and many other roles in the field of genetics. And about 17% of genetic counselors at this point in time work for commercial laboratories. Next slide, please. So when we think about clinical genetic counseling, where a genetic counselor works within a particular clinic, whether it's with a genetics group that specializes in nephrology, it might be in a prenatal setting, it might be in a pediatric setting, in general pediatrics, it might be in a much more specialized setting. There are many different sort of hats that the genetic counselor will wear. In meeting with patients, we collect a personal and family history. That's a huge and important tool in understanding a person's genetic risks. We will talk with the patient about what kind of testing might be available and what that testing might tell them, what it can tell them, what it won't tell them. We also like to make sure that if a person decides that they would like to have some sort of genetic testing, we make sure that when those results come through that we talk in great detail with the patient about the results. We certainly make detailed notes for other healthcare providers, like the provider who may have referred the patient to us. We talk with our colleagues to better understand if there might be something different that we need to do for a patient. A big part of seeing patients in the clinic has to do with reviewing their medical records and understanding what kind of testing they may have had before they get to the genetic counselor. A big thing that, like as a genetic counselor, as a prenatal genetic counselor that I did when I was talking with a couple where the child was found to have some sort of a condition of some sort, is that we may have to refer them to other specialties like cardiology or a neurologist. There are times that we have to refer to other people as well. And in your community, genetic counselors are well connected with other specialties when they need to refer to other specialties for a patient. Next slide, please. So in industry, genetic counselors are very, very involved with communication. We communicate with providers. We communicate sometimes with patients as well. Other things that we might do in industry would be to help create a testing panel, an accurate testing panel. We may get involved with the curation of genetic variants. We do a lot of documenting. We review test results to make sure that the test results are clear. We make sure that when test results are created, that they're accurate and that they reflect the true results for that patient and that provider. So many of the things that we do in industry are similar to what we do in the clinic, but it can be just slightly different. Next slide, please. So there are definitely similarities with regard to what we do, whether we work in the clinic or whether we work for a laboratory or in other fields. One of the benefits that I think genetic counselors provide is to give really clear communication. We can talk to patients about really complex genetic issues in a way that person is going to understand. We can translate those complex ideas and make it understandable for everybody, whether it's the provider or the patient or both. And we also have that genetics expertise. And in this world, genetic testing, and I've seen this over the past 30 years, actually. Genetic testing has just become more and more and more important, no matter what the medical specialty is. But it's complicated. And it's one of those things that requires time and effort to communicate well. And we try to really manage expectations for patients and providers surrounding genetic test results. And one of the premises of genetic counseling is that it's very non-directive. We don't tell patients, this is what you should do, this is what, this is how you should proceed. We give them options. We talk to them about what their options are. If they decide to pursue genetic testing, we help arrange that. And that is not always really easy to do. Sometimes genetic testing can be really complicated, and that's what a genetic counselor is supposed to do, is to help patients navigate that path of having genetic testing, getting the genetic test results and understanding them. And no matter what, we always know and believe and work with the idea that behind every sample, whether you're in the laboratory or whether you're in the clinic, there is a patient very anxiously waiting for that information. Next slide, please. So I chose this slide just because I really think it touches on the things that are very important in genetic counseling and in genetic testing for kidney disease. Sometimes we can really, when you think about diagnostic value, we can confirm and reclassify sometimes a person's diagnosis. We can establish if there is a genetic diagnosis. We can work with providers to think about prescribed therapies that would be helpful to that individual. We can help determine eligibility for clinical trials, and that's one of the things that I've done in the last 2 years, and it's extremely rewarding to see that there are clinical trials that can benefit patients if they choose to be involved, and not everybody does, and that's okay. We make referrals outside of the kidney space when we need to, like to cardiology or audiology or wherever a patient may need to go. And then we help with family counseling and understanding what the risk is to other family members. And maybe if someone's of childbearing age, if we need to talk about family planning, that's a big part of what genetic counselors do as well. So that's my last slide, and I am happy to answer any questions that people might have with regard to what genetic counselors do, either in the kidney space or in any space.
Thank you so much, Libby. You did a fantastic job at rounding out these talks for this session. It was great to hear the 3 very different yet equally important healthcare professional roles that serve our patients with rare diseases and kidney disease. I think we have time for one question for you, Libby. And I'll ask this question that came in, which is perfect, leading up to tomorrow's Innovation Day. So with the increased innovation in genetic research, how can genetic counselors and other providers keep up with new information?
It's a challenge. It's definitely a challenge. And I think that, keeping up with new information would involve making sure you're going to continuing education meetings, making sure that you're part of an organization. Like for me, it's the National Society of Genetic Counselors, making sure that you're keeping in touch with advocacy groups as well. There are many advocacy groups out there that focus on certain areas, certain health areas, and certainly within the kidney space, it's no exception. And those advocacy groups are also extremely valuable in helping us keep up to date with what's going on. And of course, keeping up with the reading of journal articles.
Absolutely. Well, thank you so much. We have so many questions that we didn't get a chance to answer, but you can always send those in for our audience. Please reach out to send those in. This has been such a great discussion. You can visit Kidney Action Week website for more resources and information for healthcare professionals and about healthcare professionals. As I believe Deb touched on, we offer a variety of free accredited CME courses for professionals. And I also suggest you learn about our clinical scientists and nephrology fellows and the research they're doing to advance care for kidney patients. Once we conclude the session, you'll see a poll for a quick survey pop up. Please take a minute to fill it out and tell us how we did. Your feedback is very useful as we plan future sessions. And I hope you're able to stay on to join us for our next session at noon Eastern Time, highlighting Kidney Kitchen Pro, our digital resource for dietitians. So Alicia, Dr. Hain, and Libby, thank you again, and thank you to our audience for tuning in. We appreciate it. Happy Kidney Month, everyone.
Thank you.
Thank you.
Thank you.